The purpose of this short video is to demonstrate a solution for the integration of the map of medicine and EMIS that we've developed here in the Isle of Man. Whilst this solution works for EMIS, there's no reason why it shouldn't work for Medway and Rio in due course. What you're about to see is a live demonstration using a live EMIS system working across the government network. So let us imagine that we have a mythical patient, Miss Minnie Mouse, who has heart failure. The first thing that we would need to do, of course, is open the map at the appropriate page. Now, we can do this in all sorts of ways. You can do it with an EMIS protocol, which is either linked to the heart failure diagnosis, or run from the protocol button at the top here. But to save time, I've already got the map open over here. The map shows you boxes, most of which have more information available within them, and those ones are shown with an I. You will see that some have an L, and this is the local information and the information that we use to populate the EMIS notes with the appropriate box. So, for example, information resources for patients and carers gives you a whole lot of leaflets that you can print out and give to patients, or indeed website addresses for them. The background information shows the scope of who this pathway is for. More importantly for us, however, the local information is accessed by pressing that tab, or alternatively just by clicking on the L. Now, one of the most important things about a pathway is noting that your patient is following it. So let's just simply click on there, and you'll find that it will enter this directly into the patient's notes. And then at the top here, a box appears marked Resume, which will take you back to the map. Let's imagine we now want to see what the clinical features of heart failure are and what this patient has. We click on there, it will give you a list of the signs and symptoms to be looking for. Most of us will know those, so you can click straight to the local information and onto there, which runs the appropriate heart failure template within EMIS, allowing you to record history. So, for example, that they're breathless at night, on mild exertion, have PND, ankle swelling, their weight's increasing, nocturia and confusion. You can enter the cardiovascular examination, showing the blood pressure to be 116/78, with a pulse rate of 66, shall we say, which is regular. Now, plainly, you don't have to enter things in all of these. You can enter as much or as little information as you want. And once you're finished, press OK, and those all, of course, appear in the notes exactly as you would expect. And then you press Resume and it returns you to the map. Having examined the patient, you're not sure whether this patient actually needs to be admitted urgently or not. Fortunately, the map gives you the red flags that you can check on here. Having thought about it and looked at these, you decide your patient actually isn't that bad, but you probably do need to record that you've thought about it, so simply clicking there enters into the notes for you that there's no evidence of red flags for heart failure requiring immediate admission. Resume takes you back to the map, and you start to look at initiating investigations. Clicking there will bring up the standard investigation template, already populated with the routine blood tests that you would want in a patient with suspected heart failure. It stops at this point to allow you to decide whether you're going to tick sample taken or print forms. It will deal with either. Once you're happy, press OK and it returns into the note, and then we'll also add that an ECG is being requested as the final part of the diagnosis investigations. And Resume, of course, takes you back to the map. Imagine that we've now received the results of the BMP, and that they're raised. Again, clicking on the L and noting the abnormal BMP just simply returns that for you. Now that means, as it says here, that you're going to refer them. So, as you know, there'll be a little bit of a delay before the scene. You decide that you better do something in terms of treating this patient. And the initial management is here. You can either just double check on it yourself, or go straight into initiate treatment, asks you what treatment you want to start. Let's say what I used to call frusemide, 40 milligrams. Well, I'll tell you what, with bumetanide this time. How many days treatment? Well, you hope they're going to be seen within 14 days, but you better give 28 days just in case. It then brings up the standard prescribing template that you're used to, populates that for you, shows you that the warnings are present. If you override that, it then continues and then goes off and enters the prescription into the system, and indeed enters the records as well. Pressing resume takes you back to the map. Doing the referral is just as easy. Click on the referral box and that will pull up a box asking you whether you wish to use a task or an MS letter, which are questions you will remember from the standard referral box. At the moment I'll say neither of those. It pulls up and again populates all the standard boxes for you. You can again no idea why that went black. And then press OK and you're happy with that. Now normally you would look at pressing abort at this stage because we do need to make. Patients do not always manage to follow the pathway for all sorts of very good reasons, and that really should be recorded. So going back to the background information, you'll see there's another box marked Note Variance from Pathway. So simply clicking on that will bring up a little box asking you to explain why it's not suitable. So in this case we'll say the pathway is not suitable due to comorbidity. Ask you for a bit more information, which we can enter. And again, all of this is recorded directly in the notes. And we'll save that. You'll see that would stand up to most medical legal scrutiny, and in honesty probably far better than most GP records will. However, there are going to be times where you want to use some of this methodology, but you know the pathway, and there is a way around that. If we note on the side here that we have added an extra menu, that menu gives you access into all the shortcuts without actually going back and forwards to the map. So, for example, we click on this one, it will simply enter into your note that there are red flags. Or, clicking on this one will pull up the pre-populated investigation template for you, etc. That means that in cases where the map is well known to you, you've still got the automated functionality, but without having to flick back and forward. But you can always rerun the map from the bottom icon here. And that really concludes the demonstration. We can, of course, customize this to virtually any requirements, and this is really just meant as a demonstration of what is possible. Thank you.